Hi, welcome to the Borat Minda podcast, a Bahasa Rojak podcast on mental health. I'm your host Zulaikha, and for the month of October, we have 5 special episodes brought to you by AIA Malaysia for the AIA See the Other Side campaign that aims to drive conversations on mental health, lift the lid on mental health conditions, and break the stigma. We will be touching on mental health stigma and mental health conditions such as major depressive disorder, obsessive compulsive disorder, and a few others. As always, we will be highlighting the stories of people with lived experience of mental health issues. We will also be bringing in some experts in the field to share their insights, so watch out for that. For those who are new to the podcast, I'm Zulaikha, a psychology graduate who's currently studying a master's in global mental health. I'm also the co-founder of MINDAKAMI and a person diagnosed with a bipolar disorder type 2. You can listen to the Borat Minda podcast on Spotify, Apple Podcasts, and YouTube, as well as keep up to date with us via Twitter, Instagram, and Facebook at the handle MINDAKAMI. If you'd like to learn more about AIA, one of Malaysia's leading insurance providers, visit aia.com.my. Let's start by addressing stigma. So what is stigma? Stigma is a mark of disgrace that sets a person apart from others. Stigma merupakan tanda keaiban bagi seseorang yang boleh dilihat sebagai lain daripada norma masyarakat. When a person is labeled by their illness, they are no longer seen as an individual but as part of a stereotype group. Negative attitudes and beliefs toward this group create prejudice, which leads to negative actions and discrimination. Dalam konteks kesihatan mental, stigma menyebabkan masyarakat kita rasa malu untuk bercakap tentang kesihatan mental dan menjauhkan diri daripada orang yang berpenyakit mental. Stigma merangkumi kepercayaan kita dan sikap kita terhadap sesuatu, dan ini boleh menyebabkan kita prejudis terhadap kumpulan-kumpulan tertentu dan mendiskriminasikan mereka. So there are several types of stigma that we need to be aware about. These include public stigma, structural stigma, and self-stigma. Public stigma, or stigma masyarakat, are attitudes and beliefs of the general public towards persons with mental health issues or their family members. Structural stigma atau stigma organisasi is an organization's policies or culture of negative attitudes and beliefs. While self-stigma ataupun stigma kendiri, this happens when an individual buys into society's misconceptions about mental health. So how does all of these stigmas look like? So examples of public stigma, these are like phrases that may come up when we think about public stigma. For example, people with mental illness are violent, and this can be seen from maybe films, media, and the sensationalization of news. Another phrase that we often hear is, people with depression are just lazy. People with anxiety are just overreacting. And another common thing that we might hear that could be an example of public stigma is, penyakit mental sebenarnya adalah rasukan jin atau makhluk halus. This causes people to downplay or misinterpret mental illness that has a biological, psychological, and social cause. Dari segi structural stigma, kita boleh nampak ini berlaku contohnya daripada situasi di mana pekerja itu dipecat apabila didapati mempunyai diagnosis penyakit mental. For now, there are no procedures or policies to protect people with mental illness against discrimination. This is from Relate Malaysia's website on the Persons with Disabilities Act 2008. In the website, it says that Dr. Tiun Ling Ta, the president of Persatuan Orang Cacat Anggota Malaysia, pointed out that the federal constitution specifically prohibits discrimination on the grounds of religion, race, descent, place of birth, and gender. However, discrimination against persons with disabilities was surprisingly omitted. Dr. Tiun pointed out further that unfortunately, the recognition for the rights of persons with disabilities in Malaysia seems to come from a charity-influenced intention rather than an inherent right. The Act does not provide any clause for anti-discrimination but only appeal to the authorities, bearing words such as merayu, meminta izin, and hendaklah. The scene that is set for this act seems to merely be advisory rather than enforcing, in comparison to the execution of the National Service Act, where students face penalties for failing to report for training. Simply put, we have some ways to go in terms of protecting people with mental illness and more broadly people with disabilities from discrimination. But we do have a bit of good news here. According to the Star Online's headline on the 27th of September, recently, the Women's Ministry will be forming a task force to discuss the amendment of the Disabilities Act. Moving on to examples of self-stigma. A description from the Mental Health Foundation of New Zealand says that self-stigma is an internalized stigma that eats away at our self-esteem and self-efficacy. It is like a voice inside our head that tells us that we aren't good enough. Feelings of shame and guilt often come with self-stigma when we are led to believe that we have broken some unwritten code about what it means to be a full member of society. So this can be seen through, for example, being scared of being labeled gila. Personally, I was really scared about the idea of taking medication or going to therapy for my own mental health issues because I feel like I would be labeled as maybe gila or abnormal, and this ultimately prevents us from seeking help. And all of these types of stigma, whether they be public stigma, structural stigma, or self-stigma, all of these stigmas can occur together at one time. So we can understand that stigma can stem from various angles. But you may be wondering, why should we even care about the existence of stigma? How does it impact, patients, family members, and society in general? Stigma creates a huge barrier for people to seek help for their mental health. I picked out some excerpts from a qualitative study that explored the perspectives of mental health professionals on stigma and discrimination of mental illness in Malaysia. So this is done by Ainul Ladira Hanafia and Tyne Van Bortel, published in 2015. It says that patients' self-perception and self-empowerment are most adversely impacted by stigma. These may consequently affect patients' help-seeking behavior and compromising their recovery. A government psychiatrist shared, "It's a vicious cycle. People avoid or reject them. Then they feel neglected and they feel small, so they refuse to come to the clinic or hospital because people will see them there. Obviously, without treatment, they are going to get worse. And what happens next? More stigma. So who's going to break the cycle?" We do know that prevention is better than cure. But when seeking mental health help is frowned upon, we are less likely to address mental health issues at the early stages, before things get more severe and have a more detrimental impact on people's lives. You may not be aware that stigma has economic impacts. The inability for patients to be employed leads to the incapability to be independent, and this leads to disempowerment with negative consequences not only for the individual but also for wider society. A private clinical psychologist shared, "Patients are thrown out of their own homes and they don't know where to go, so they sleep by the road or back alleys. They are left tattered and dirty. So how to get a job? Without a job, how to get money to live? So they are stuck, having to rely on people for it. Sometimes having to beg. They have no power at all. Ini adalah realiti yang dihadapi mereka yang didiskriminasi akibat diagnosis penyakit mental. Setakat ini tak ada lagi undang-undang yang melindungi kumpulan ini daripada diskriminasi dan dibuang kerja. So overall, people with mental illness will bear the burden economically, and poverty further exacerbates this problem, causing a vicious cycle. We also know that according to the World Health Organization, depression is the leading cause of ill health and disability worldwide. More than 300 million people are now living with depression, an increase of more than 18% between 2005 and 2015. We also know that there is a link between mental health and physical health. So we must not undermine either of these in order to become a healthier society. The more we ignore mental health, the more our healthcare costs will rise, not only at an individual scale, but also as a country as a whole. Stigma can also lead to the abuse of people with mental illness, whether it be, emotional abuse, physical abuse, being bullied, or being isolated. Contohnya di kawasan kampung Indonesia yang kurang didikan kesihatan mental, ada diamalkan praktis pasung, iaitu orang yang mempunyai masalah kesihatan mental dirantai pada katil batu bata atau kandang haiwan. But the health ministry has urged for psychosocial services to be made accessible to these people. So something is being done to actually address these problems, hopefully. Next, what actually causes stigma? What are the factors that contributes towards mental health stigma? A large part of it is a lack of education and awareness. Mental illness involves a multitude of symptoms from behavioral to mood changes. Culture and religion play an important role as, on the whole, the general public in Malaysia believes in supernatural or spiritual causes as the etiology of psychiatric conditions. Within Malaysian society, superstitious reasons are easier accepted than medical or physiological explanations due to the latter reflecting possible genetics or biological failure. Sebagai masyarakat, kita susah nak percaya yang penyakit mental ada berbagai-bagai penyebab yang termasuklah genetik dan biologi. Another factor that could lead to mental health stigma includes negative media portrayals. Sumber utama penyebaran informasi termasuklah media tradisional iaitu TV dan radio dan juga social media can lead to misguided views that people with mental health problems may be more violent or unpredictable than people without such problems, or somehow are just different. But none of these beliefs have any basis in fact. Research has shown that people with mental illness are actually more likely to be victims of violence rather than engaging in violence themselves. For example, the pasung practice that I mentioned earlier. With all of this said, what can be done to combat stigma at all levels? So this could be at an individual and community level, in terms of policy and legislation, and also government initiative. At the individual and community level, we can try incorporating conversations about mental health into our daily lives to make it more common and more acceptable. Wider advocacy and education will also need to be implemented, using accurate representation and basing information off of credible sources and experts in the field. So this can be done through mental health forums and educational workshops, social media, making videos, posting them on YouTube, having a podcast. So for example, our podcast here, the Borat Minda podcast, and also psychiatrist Dr. Amir Siddiq also has a podcast on mental health. We can also do community events. For example, one of MINDAKAMI's projects include Tea and Talk, which is a casual gathering that brings together people to talk about mental health and daily life struggles. We try to do it monthly and make it small so that everyone gets a chance to listen and share. You can visit our social media platforms or website at mindakami.org to know more. Changes in policy and legislation can also have a major impact towards addressing mental health stigma. Most importantly, we need policymakers who are trained to develop appropriate policies and plans related to mental health. As previously mentioned, having anti-discriminatory laws for people with mental illness can help curb stigma and prevent them from being discriminated against at the workplace or any other institutions. Another major change that could happen is also decriminalizing suicide and maybe also making mental health education mandatory at schools and workplaces. Our government must also recognize the importance of mental health so that mental health stigma will ultimately be alleviated. There are some notable initiatives implemented by the government to address mental health problems. For example, the establishment of Mentari centers nationwide. Mentari is a community mental health center which can make mental health services accessible to more people and can indirectly make people aware that mental health issues are a common thing to talk about. In May 2019, YB Said Sadiq, the Minister of Youth and Sports, also organized a forum on mental health issues among youth entitled Are You OK? At the International Islamic University of Malaysia. So this forum also included two other panelists, which are Dr. Hazli Zakaria, the President of the Malaysian Psychiatrists Association, and Dr. Nur Ashikin Ibrahim, a public health physician and sector head of mental health, substance abuse, and violence injury prevention. Having publicly open forums like this can help open the doors for discussions on mental health and debunking harmful myths. YB Hana Yo also recently announced the launching of the first psychological care center in KL, located at Perumahan Awam Desa Rejang. She says that now counseling has come to the doorsteps of the B40 community. So these are really great efforts into addressing mental health issues in the country. You have to give credit where credit is due. And we really hope to see more impactful changes being made in the near future. We're now at the end of our episode on stigma. Thank you for listening. I hope you now have a better insight into mental health stigma, how it manifests, and the impact it has on our society. This episode was brought to you by AIA's See the Other Side campaign. Remember to subscribe to the Borak Minda podcast on Spotify, Apple Podcasts, and YouTube. Thank you so much, and I'll talk to you soon.